every sexually active man feels that this is a supplement. It's almost a supplement for every man that is sexually active. I want to talk about Vega, or rather, I want to talk about sildenafil citrate because there are several brands. So it is not about Vega, but it's about sildenafil citrate. Sildenafil citrate, right? Actually, it belongs to a class of drug called phosphodiesterase 5 inhibitor. So literally, this is usually used in treating erectile dysfunction as well as also known as impotence. When you say someone is impotent, it means that the person cannot maintain erection even when sexually aroused. Impotent is kind of a harsh word. It was what was formerly used, but now it is now called erectile dysfunction. That sounds better. That sounds, sweeter somehow. This sildenafil citrate is used in the treatment, or instead, let me use management, not treatment, of this erectile dysfunction, right? But my question is, so many people take this ignorantly. So many people take this ignorantly. So many people take it because of peer pressure, because they've seen their fellow guys taking it and they feel that this is a multivitamin that would enhance your sexual performance. But darling, it is not. If you're taking this when you don't need it, you're doing yourself more harm than good. Today I'm going to be discussing the category of people that shouldn't take this, when you should take it, and how you should take it. So first of all, who are those that should take this? Those that are experiencing erectile dysfunction, not occasionally, but not occasionally, but frequently. Occasional erectile dysfunction could occur due to stress. It could occur due to depression. That is fine. Do you understand? That is fine. It doesn't mean that you're impotent. It only means that you're just acting because of the stress, because of the depression, maybe due to trauma or whatsoever. So at that point in your body acting in response to that could affect your erection. It could. So that is because of the stress. So another thing that could cause this erectile dysfunction, another category of people that could experience this erectile dysfunction, are those that are on some medications, like some antihypertensives could actually cause erectile dysfunction, right? So it is important, if you're supposed to take this or not, always consult your doctor. The category of people that could take this under their doctor's supervision are people that falls under the category of stress-induced erectile dysfunction, right? At that point they can take it. But for those that fall under the category of cardiovascular illness, diabetes, because of the medications they are taking, they are not experiencing this, they should consult their doctors. There are actually alternatives that would be free from this erectile dysfunction. Now, who should not take Vega? Who should not take sildenafil citrate? If you're on certain medications like nitrates are usually used in the treatment of angina, you shouldn't take this. If you have low blood pressure, this moreover works by relaxing the smooth muscles in your region. So it basically relaxes your smooth muscles, thereby improving blood flow to your penile region. Imagine something that relaxes your smooth muscle. I remember that smooth muscles are also found in the heart. Because of this would cause drop in blood pressure. Because it will cause drop in blood pressure. If you're already experiencing low blood pressure, it will be further dropping. Because it will be further dropping, it is dangerous to your health. Low blood pressure is as dangerous as high blood pressure. That is what you should know. If you're experiencing low blood pressure, stay away from this. If you're taking medications such as nitrates for angina, stay away from this as well. If you're taking medications, any medication at all, always consult your healthcare provider, your pharmacist, before taking this. And also, it's important that this works. This is not for treatment. So basically, this should be taken 30 minutes before sexual intercourse, and the fact that you've taken it doesn't automatically mean that you're going to be you're going to be you're going to experience that what's it called, that erection. It only means that you can experience it. So you would also require sexual result before you experience that erection. I don't know if I'm making sense. Right? Yeah. And also one tablet, which is 100 milligram, could last for 24 hours. I'm saying this because there was a time someone told me that he took 4 tablets of this at once. Now, what could result to that? Taking 4 tablets of this at once could result to prolonged erection. And this is not something you want to experience as a guy, because this could cause severe pain on you. There's a condition called preparism. This is prolonged erection. So, but this one now is actually a condition on its own. It is this condition on its own. It's not something you want to experience. One tablet, which is 100 milligram, could last for 24 hours. The onset of action is about 30 minutes. So that is why I usually advise that you take it 30 minutes before sexual intercourse. It's not a supplement. It's not something you take every day. So if you're noticing that you're having erectile dysfunction, you're not erecting as you should, consult your doctor so that the reason why you are experiencing this erectile dysfunction would be settled, because there are actually things that could cause erectile dysfunction. Things like cardiovascular disease, maybe high blood pressure or its relation. Also, diabetes can cause it, that is high blood sugar. High blood sugar affects the nerves, and anything that would affect the nerve could impede blood flow to your penile area. Do you understand? Also, if you're having kidney related issues, that is renal issues could impede blood flow. It could lead to poor functioning of your nerves as well. Do you understand? So anything that could result to nerve damage, that could impede blood flow to your penile area, could cause erectile dysfunction. So always seek the attention of your doctor to know the underlying cause of this erectile dysfunction, so that it could be settled, because this is not for treatment, this is for management. That is why after a day you still experience the same erectile dysfunction. That is when this has worn off, you still go back to your usual self, which is not something you want to experience. I remember when I also said stress could also cause erectile dysfunction. So that is actually a temporary form of erectile dysfunction. But if you're having cardiovascular issues, diabetes, renal issues, of course those issues have to be managed, they have to be taken care of, so that this erectile dysfunction would also be taken care of. So there are safer alternatives to this film citrate, and one of those are L-arginine, L-carnitine. I think I should show you a picture. So this is L-arginine. L-arginine also helps support blood flow to your brain region, and by doing that it also helps with erectile dysfunction. So this is more like a supplement, but always seek the attention of your doctor before you take this, so that's how long you take it, and even if you're supposed to take it. I hope this helps.